It's still flu season. You don't feel very well at work. When do you go home? And just as important, when do you come back to work? We'll have the answer to those questions, plus we'll check out the new Revenue Cycle Center here in Adams Farm. Those stories and more in this month's Code View. The flu epidemic leaves no one alone, not even healthcare workers. So to protect our patients, go home as soon as symptoms hit and don't be in a rush to return.
You're likely starting to shed virus even before you've started to feel these symptoms coming on. And we like to have people just stay home until they are free of their fever without the use of Tylenol or ibuprofen, and then stay at home for 48 hours and then they can return back to work.
Don't forget that every flu absence needs to be reported through the Safety Zone portal.
3, 2, 1.
With the snip of a ribbon, one of the last major parts of the North Tower project at Moses Cone Hospital opens. The central stairway connects the main entrance of the hospital to the main patient exit in the atrium. Initial plans were unveiled in 2009 for the North Tower project that has completely changed this campus.
North Tower is now our new face. It's the entrance. I've received a lot of positive feedback from our welcoming first impression that we now have with the wheelchairs and more volunteers and our coffee shop there. And the stairway would just positively promote that going forward. So I'm very excited about that.
Finishing endoscopy areas will be the final part of the project. These posters tell great stories: how to improve care to heart patients, how to reduce surgical site infections, how to open a new hybrid operating room. These nursing posters represent some of the ways Cone Health nurses share research or quality improvement projects.
I'm really excited about having the opportunity to share what we've done and really share so that others can learn from our experiences. And I really think we have something unique here that's worth sharing.
6 posters have been accepted for the coming Association of Perioperative Registered Nurses Conference. Welcome to Cone Health's Revenue Cycle Service Center. This building brings together the people who handle hospital pre-registration, billing, collections, and customer service.
We'll be able to handle more accounts more efficiently and at a lower cost because we'll have more resources. So that's the ultimate goal in creating a Revenue Cycle Service Center, is for standardization, efficiency, and cost savings.
The center opens this month. 155 employees will work there. Anxiety, depression, marital problems, all of these can be overwhelming. There is help. Cone Health has a new employee assistance program. It features the resources of Cone Health and provides a deeper level of counseling.
We don't just assess and see people a couple of times and refer them out. We actually provide the therapy so that a person may come in and see our therapist 5, 6, 7, 8 times. Just depends on what they're working on. There's not an arbitrary limit to the number of sessions a person can have.
This employee assistance and counseling program was previously used at Alamance Regional Medical Center. To schedule an appointment or for more information, call 538-7481. Alamance Regional Medical Center employees have a convenient place to manage their money. HealthShare Credit Union has opened a branch inside the hospital across from the cafeteria.
We're going to be able to serve the employees of Alamance where they work. We'll be able to provide banking services right where they're at every day.
HealthShare Credit Union offers many of the same services that other financial institutions do. You can also handle most financial tasks online. That's it for this edition of Code View. I'm Doug Allred, and we'll see you next time.